In today's video, I am going to explain two major dysfunction after concussion. Concussion is severe event when you play American football, when you play martial arts, when you play physical contact sports. Then somebody hits your head, then brains shake, then this can trigger so many dysfunctions. At the time filming this video, I am studying about acute concussion and chronic concussion mechanism. Then I noticed there are two major syndromes or symptoms after concussion. One is eye movement, ocular movement, and balance issue, vestibular issue. Now, what kind of eye movement, eye dysfunction do I find? Well, one thing is when I explain patient to follow my finger like this. You have seen this test for martial arts and sideline on the American football, right? When I ask patient to follow my finger movement, of course their eyes move with my fingers, then suddenly their eyeball kind of shaky, like boop movement, or it kind of jerky. It's not smooth, it's like boop, boop. It's this kind of movement. This movement is called nystagmus. After concussion patient for acute or chronic, they tend to have nystagmus or some sort of eye movement dysfunction. I see it very often. Not only after concussion, maybe you see nystagmus after car accident and heavy trauma for head. One more thing is vestibular dysfunction. Vestibular dysfunction, balance dysfunction. When somebody lays on the table, now they feel somebody's putting their head, whole body into massage table. Or if somebody is laying down like this, somebody may feel somebody's putting his body towards his leg. This is obviously balance issue, balance dysfunction. Now, what can I say? I am therapist. So, after concussion, then maybe osteopathic approach or hands-on treatment may help for this kind of ocular movement dysfunction and balance dysfunction, vestibular dysfunction. I had one young man that used to play sumo, then his opponent hit his head, then he passed out. Now he got obvious concussion. He had obvious nystagmus, obvious oculomotor dysfunction and balance issue. Then I did osteopathic approach and brain technique from osteopathic technique. Now after 4 or 6, 10 sessions, his eye movement got much better and his balance issue got much better. I do not say this kind of hands-on technique always helpful after concussion. Maybe somebody needs rehab. Maybe somebody needs vision training rehab or other kind of rehab. However, sometimes hands-on technique may help for such a concussion syndrome. There's a way, there's possibility. So what I want to say is there are other ways to treat, to cure concussion symptoms. I have to keep repeating. This does not guarantee 100% effect. Of course, there is possibility that somebody may not have gained from hands-on technique, but it's good to know. There are some other choices and there are some other ways. If you liked today's video, please hit the like button, comment, and subscribe. See you next video.